Hi, I'm David Greene, CEO of the Florida Pain Network, where we connect those in pain with pain relievers throughout the state, including pain management clinics and doctors, chiropractors, and physical therapy practices. The topic today is what to expect with an epidural steroid injection. Well, an epidural steroid injection is one of the most commonly performed procedures in the United States today. It's performed for sciatica from a disc herniation or spinal stenosis with symptoms going down one or both legs. And it's done in both the neck and the low back. Today we're going to talk about lumbar, low back, okay? So when you have sciatica or spinal stenosis and you go in for treatment, one of the most common treatments is an epidural steroid injection. It can be done as a one-time injection or as a series of procedures. And the typical series is 3 injections in a row, 1 or 2 weeks apart. If the first or second one works really, really well, you don't need the third one, okay? So, but if it works a little bit, then you probably should go ahead and have the rest of them. So these injections are done as an outpatient procedure. You don't need to stay overnight for them. You also don't have to have IV sedation for them, but you can, if you have claustrophobia, anxiety, if you've done well on IV sedation before, you might want to have that performed. But you could just maybe take a Valium 30 minutes before, or you could just have some numbing medicine injected around the skin and down through those soft tissues. The pain doctor will do that anyway, but that might be all that you require, okay? So the doctor will tell you how many hours beforehand not to eat or drink. So be on the lookout for that. They'll check you in, probably give you one of those identification bracelets, probably put a gown on you, things like that. Doctor will come in and say hi and verify what levels are going to be performed, where your pain is. And then when you have the procedure, most modern pain management doctors use fluoroscopy, which is a real-time form of x-ray. It's a big machine that looks like a C. They call it a C-arm, okay? Or some do it under ultrasound. Both allow for precise placement of the needle around the nerve root, okay? The procedure itself takes anywhere from 10 minutes to a half an hour. That depends on how hard your anatomy is, how much extra soft tissue you have, how many levels are being performed, all right? But, give or take. And then once the procedure is completed, you go to the recovery area for 30 to 60 minutes. If you had IV sedation, they may keep you longer to monitor your vital signs, make sure there's no allergic reaction and whatnot. Then you'll be given instructions as far as what to look for with whether you have a fever that persists, whether you have pain that's out of control, excessive bleeding, things like that. If you're on anti-inflammatory medication or anti-clotting, like Coumadin or ibuprofen, things like that, talk to your doctor ahead of time because they're going to want you to stop those. And they'll talk to you about when to stop that. Okay. Lastly, what are the risks and outcomes of epidural steroid injections? Well, studies have shown anywhere between a 75 and 85% good to excellent results. It's a very satisfying procedure. It's been done for over 60 years. It keeps getting better because there's more ways of doing an epidural steroid injection, and now that we have the real-time x-ray, it's gotten better. There was a study that came out a few months ago that showed over an 85% good to excellent results in pro football players. So the results are there. That's why it's the gold standard procedure for avoiding surgery and what all other types of procedures are compared against for sciatica. So that's about the results. Now, it may be that, like I said, you might need all 3 injections or one may do the trick. It might be that the results, you get immediate pain relief and then it goes away, and then 3 days later, it kicks back in again. It can take the steroid a little bit to kick in, whereas the numbing medicine usually starts to work right away and then wears off after 6-12 hours. So that may be, you might get awesome pain relief, might go away, and then come back, okay? So the risks of the procedure are small but real. Small risk of infection, small risk of some bleeding, small risk of an allergic reaction, and also a very small risk of a nerve injury. That's extremely unlikely, but it could happen. If it did happen, usually it's something temporary. It lasts for a couple days. The other thing is sometimes blood sugar spikes up, and then it just kind of goes back down. So be on the lookout if you're a diabetic. All right, there's the main things of what to expect with an epidural steroid injection. On our website, floridapainnetwork.com, if you click on I need a pain doctor or I need a chiropractor, you can just put in your zip code and it will show you the clinics closest to you. And we have quite a few of them. A lot of them take a ton of insurances, board-certified pain doctors that do all kinds of medication management and procedures. I'm David Greene, CEO of the Florida Pain Network. Your pain stops here.